I actually grew up in Pittsburgh, and so I knew a lot about UPMC before I came to this program. I knew that UPMC was a great place to train residents. There's a lot of pathology here. There are a lot of different hospitals, and the patient population is very diverse, so I knew that would be a strength of any training program at UPMC. But when I came here for my interview, I was really impressed with how comfortable the residents made the program seem and how supportive the faculty was. So I knew it was a great combination of an academic challenge and a great academic environment with the combination of a great nurturing environment to learn.
We realized during our interview day that the residency program was more of a family than a residency program. Our residents are some of the closest that I saw on the interview trail, and that was one of the major pulls to our program.
I think what really sold the program to me was how the residents interacted with each other. They're very close and supportive to each other. I had the sense that they would go out of their way to help each other out. What I like about UPMC in this program is that there is a lot of time outside of the reading room. Typically, rotations end at or before 5 p.m. And as a first-year resident, you typically have almost all your weekends off. So this gives a lot of time for the residents to enjoy their weekends, visit family or friends, or explore the city.
Pittsburgh, I think, is the best possible place to be a trainee. It's both the right size where you have an abundance of opportunities available, but it's also affordable on a resident salary.
So what I like about Pittsburgh the most is that it has the sense of a big city without all the headaches. It also has a small town feel where living is really affordable, and I know friends owning their own homes or selecting apartments that are more luxurious downtown. What I also like about the city is that it's pretty diverse.
It's a really nice mix of different types of living. You can live right downtown and still be pretty affordable. You can also live just a little bit farther out and get that house with a yard. I mean, my commute's only about 20 minutes to all of our major hospitals, so it really works well for pretty much anything that you're looking for.
Pittsburgh has plenty of parks to take my dog on walks and go biking. So I think it was a great mix of having a large enough city, but at the same time having a smaller community feel.
We see a lot of this online. There's a really great food scene, a really great craft beer scene. Something in particular that I really like about Pittsburgh is the ability really to bike in the city, whether that's with quick access to city parks or riding through the city. It's really accessible to get from neighborhood to neighborhood, even to the hospitals or between hospitals. That's something in particular I really love about Pittsburgh.
Typical workday will start between 7 or 8 a.m. depending on if we have one of our morning conferences. After that, we make our way to our respective reading rooms and start picking up cases. And the workload is very manageable. We're basically splitting cases with the attendings and fellows and our other co-residents. By the end of the day, the attendings are very conscientious. They try and make sure that we've read out. Frequently, they'll check in on us at 4:15, 4:30. I might say, oh, I need a few extra minutes, but they do a great job getting us out on time at the end of the day.
One of the strongest points about UPMC Radiology and something that's very unique to UPMC Radiology is the fact that we take independent call. Our night float is set up in a way that we take 7 days straight of night float, and you're on your own overnight. You have a few residents helping you out, and you have an attending that you can call, but usually you're on your own in the hospital. And you're responsible for all the stat CTs and x-rays that are done. So you're essentially the main point of contact for the entire UPMC system when you are on call. And that sounds like a little terrifying at first, but it is probably one of the strongest points of our educational offerings because you become very good.
You do have attending backup if you need to call them, but you're basically the one in the hospital. You're the one reading the studies, putting your prelim. It really allows you to kind of get faster at reading, get faster at interpreting. You're reading stat studies, so you're calling critical results. First one to make findings, first one to alert the team of the findings. So it's really a time to sort of learn and grow. So I really enjoyed it.
Part of our advantage is that we rotate through several different hospitals, and each one has its own different sort of mix of stuff that comes in. You'll get plenty of your bread and butter stuff from our ERs and from one of our community hospitals. And at the same time, we have tertiary referral centers like UPMC Presbyterian and Shadyside Cancer Hospital, where you can really get the stuff that gets referred from a wide catchment area. So you'll see all of the weird pathologies, and you can pretty much rest assured that it's not going to be your first time seeing any given pathology once you've graduated and are working as an attending.
We have at least 4 different main academic core hospitals, including a dedicated pediatric hospital. We see everything from trauma to complex hepatobiliary interventions to pediatric cases. And seeing so much makes you comfortable when you leave that you'll be able to handle really anything that any different hospital or community setting would throw your way in terms of being able to do a case. That's true on the interventional side and the diagnostic side.
I love coming to work every day because I leave every day learning so much. We read out directly with the attending physicians, and they really do take a good amount of time going over cases with us. So if we have a complex case, we take a larger period of time in order to go over with it, to learn it, make it as educational as possible.
The ESIR residents that have graduated from UPMC and have gone on to fellowships have matched very well, usually in their top 1 or 2 on their rank list. And I think that's, again, a function of how strong our education is. It's a well-respected institution across the country. Everyone knows the UPMC name.
Since matching here, I've come to love the program so much that I'm actually staying for my neuroradiology fellowship.